Hello everyone! In this video, I am going to talk about Orlistat capsules. Orlistat is well known by its brand name, Xenical. This medication was approved for the management of obesity in people with a reduced calorie and low-fat diet. Fat in the diet is one of the main factors that causes an increase in your body weight. But if you take a high-calorie diet, again it can lead to overweight and obesity. If you are unable to see a significant weight reduction, even after strict diet control, regular exercise, and many lifestyle modifications, then Orlistat can be given to you. It can reduce fat absorption from your diet, so that fat does not add to your body weight. This facilitates your goal of achieving a significant weight reduction. When your body mass index is above 30 kilograms per square meter, you need a weight reduction, and in the presence of any risk factors like diabetes, heart disease, or hypertension, your BMI should not be above 27 kilograms per square meter. To achieve this goal, you may need treatment with Orlistat, along with diet control and exercise. In this video, let's explore Orlistat, how to use this medication, how it works to reduce fat absorption, and what the possible side effects are. We will also discuss important precautions that should be considered while using this medication. Please don't forget to subscribe to this channel, and please click the bell icon to get more updates from this channel. If you really enjoy watching this video, don't forget to hit the like button and share it with your friends. Now, let's see how to use this medication. Orlistat is available as a 120 mg capsule, and it is to be taken 3 times a day with each meal. It can be taken immediately before the meal. It can also be taken during the meal or within 1 hour of meal intake. It is also available as a 60 mg capsule under the brand Ali as an over-the-counter medication. It is again intended for weight loss in adults 18 years of age and older, and each capsule is taken 3 times a day with each meal. Orlistat will be prescribed to you for continuous use up to 3 months, and after this period, weight reduction will be assessed. If a significant weight reduction of at least 5% is observed, then it shows this medication works for you. If such a reduction is not observed, then it is not recommended for further use. In diabetic people, the target reduction of body weight may take more time to work. Before and during the treatment, you should maintain good diet control, along with proper exercise for better weight management. You should eat a balanced diet, with fewer calories to enhance weight management. Each meal should have a sufficient fat content, and it should be distributed over 3 meals of the day. Suppose if you are taking a meal with no fat content at all, then intake of Orlistat is not required, as this medication mainly targets fat breakdown and absorption. Similarly, if you miss a meal, there is no need to take Orlistat at that time. Now let us see how this drug acts. Fat is one of the important components in your diet that adds more weight to your body. Fatty meat, fried fish, whole milk, and full-fat cheese are rich sources of fat in your diet. It is composed of complex triglycerides, which are not directly absorbed into your blood. This breakdown of fat into simple fatty acids is carried out by enzymes like gastric and pancreatic lipases. In the intestine, these complex triglycerides are fragmented to release free fatty acids, which are easily absorbed. Orlistat binds covalently to these cleavage enzymes at one of the active serine sites. This inhibits the activity of these enzymes so that they are no longer able to break triglycerides. As triglycerides are neither fragmented nor absorbed in the duodenum, they are further transported along the intestine and finally excreted through feces. This reduces the availability of free fatty acids in the blood, thereby reducing the high-calorie supply, which reduces the excess body weight. But for a successful reduction of body weight, a balanced diet with low fat content and regular exercise are required, along with the action of Orlistat. Now let's focus on important side effects. Orlistat mainly causes gastrointestinal symptoms, particularly in the first 3 months of the therapy. The most common side effect observed with the use of this medication is oil spotting. You can find fatty stools with oil discharge, and you can also observe orange to brown-colored oil spots. This is not surprising, as Orlistat mainly acts by inhibiting the absorption of fatty acids. You can find fatty deposition on the fecal discharge. These fatty stools can cause fecal urgency or even develop incontinence as they increase stimulation to defecate. It can also cause smelly stools and flatulence. Diarrhea, abdominal pain, and rectal pain are also observed in a few people. These side effects are generally observed up to 1 week after the treatment, but may last up to 4 weeks in a few people. These side effects can also be minimized by reducing fat intake. On long-term use, it can also produce a few other side effects, such as colds, back pain, headaches, dizziness, and menstrual irregularities. Now we will discuss interactions of Orlistat with other medications. Orlistat can reduce the absorption of many of the fat-soluble drugs when they are taken simultaneously with it. Absorption of medications like cyclosporin, levothyroxine, amiodarone, and antiepileptics like valproate, vigabatrin, lamotrigine, and gabapentin is reduced by Orlistat. Therefore, these medications should be given either 2 hours before or 4 hours after the administration of Orlistat. Orlistat also reduces the absorption of vitamin K. This enhances the anticoagulant activity of warfarin, which actually blocks the action of vitamin K. Therefore, Orlistat may increase bleeding when it is combined with warfarin. Now let us discuss the precautions of Orlistat. The extent of gastrointestinal side effects depends on the amount of fat in your meal. With high-fat meals, Orlistat can produce significant gastric symptoms. So it is recommended to limit the fat content of each meal to 5 grams per 100 grams of food. Hypothyroidism also results in being overweight, and in a few people, it needs treatment with thyroid supplements. So if you are taking thyroid supplements like levothyroxine, then a 4-hour gap should be maintained between this supplement and Orlistat. Orlistat can reduce the absorption of fat-soluble vitamins and beta-carotene. So multivitamin supplementation is needed while you take Orlistat to maintain good health and nutritional balance. However, Orlistat again interferes with the absorption of these multivitamin supplements, so you should take them 2 hours before Orlistat intake. To avoid this interaction, you can also take multivitamins every day at bedtime. If you have any problems with your gallbladder or any previous history of the formation of gallstones, then Orlistat shouldn't be used, as this drug increases the risk of cholelithiasis. Finally, let's discuss when to avoid Orlistat. If you have conditions like chronic malabsorption, then Orlistat is not suitable, as it further reduces the absorption of fat-soluble components and vitamins. You should also avoid Orlistat if you are allergic to it or if you have gallstones. Orlistat is not recommended for use by pregnant women. In a few people, excess body weight may be associated with eating disorders like bulimia nervosa, which are associated with abnormal neuronal activity. In such cases, Orlistat is not effective and should be avoided. That's all about the pharmacology of Orlistat. Thanks for watching this video. Please don't forget to subscribe and hit the like button. Stay tuned for another interesting video with a new topic. Until then, have a nice time, take care, and goodbye.